My name is Don Fleming. I'm the Senior Education Coordinator at CASN, and I would like to welcome you to this webinar hosted by the Canadian Association of Schools of Nursing. I'd like to start with a land acknowledgement. CASN's national office is located on the traditional territory of the Algonquin people. We would like to acknowledge and pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region and in all regions across Canada. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders past, present, and future. I myself am situated on Treaty 6 territory and Region 4 of the Métis Nation of Alberta. We'll begin with a presentation this morning, and then we'll conclude with 15 to 20 minutes of question and answer. And to submit a question, please use the chat function. And please note the webinar is being recorded, and we'll send you, and all registrants will be sent a link automatically. But please ensure now that your microphones are muted. Today, we are pleased to have with us Dr. Barb Astley from Trinity Western University, Dr. Teddy Porter from the University of Minnesota, Dr. Nicole Redvers from Western University, and Jessica Leclerc, a PhD candidate from the University of Wisconsin. Their presentation is entitled Introduction to the Planetary Health Education Framework. Thank you very much for doing this webinar, and over to you.
Thank you very much, Don. As Don said, I'm Barb Astle, and I'm a professor of nursing at the School of Nursing in Trinity Western University, which is located on the unceded territories of the Struggle people in Langley, British Columbia, Canada. First, I'll give a little bit more introduction to our presenters, and who are also co-authors of the Planetary Health Education Framework alongside myself. First, I'd like to introduce you to Jessica Leclerc. She's a clinical faculty member and PhD candidate at the University of Wisconsin, Madison School of Nursing in the United States, with affiliated appointments at the Nelson Institute for Environmental Studies and the School of Medicine and Public Health. She joined UW-Madison in 2018 to empower future nurses to advance planetary health, and currently co-chairs the transdisciplinary UW-Madison Planetary Health and Justice Initiative. Our second speaker is Dr. Nicole Redvers. She's a member of the Dene Nukwe First Nation in Denendeh, Northwest Territories, Canada, and has worked with Indigenous patients, scholars, and communities around the globe her entire career. She is an associate professor and director of Indigenous Planetary Health at the Schulich School of Medicine and Dentistry at Western University, Ontario, Canada. Dr. Redvers is co-founder and past board chair at the Canadian charity, the Arctic Indigenous Wellness Foundation, based in Yellowknife, Northwest Territories, Canada, providing traditional Indigenous rooted land-based wellness support to the Northerners. And Dr. Teddy Porter is a clinical professor and appointed as the first director of planetary health for the School of Nursing at the University of Minnesota in the United States. Dr. Porter is deeply committed to climate change and planetary health education. He co-founded Health Professionals for a Healthy Climate, is a member of the Alliance of Nurses for Healthy Environments and the American Academy of Nursing Environment and Public Health Expert Panel. She chairs the Clinicians for Planetary Health and is a member of the steering committee of the Planetary Health Alliance at Harvard University.
Oh, is she? Didn't know that.
If people can just mute there, that would be great. Mute there. So moving along, Dr. Porter and I will begin the presentation describing briefly the development of the framework, and then consequently speaking about the timeline, developing the scope of the framework. And the framework, which consists of 5 domains, each will be discussed by each of us as presenters during our time together for this webinar. We live in a time whereby climate change, air pollution, soil degradation, altered biogeochemical cycles, and overexploitation of marine and terrestrial biodiversity threatens our civilization. As a consequence, socially and economically disadvantaged communities globally face a greater risk of these negative consequences. However, we are hopeful. In amongst this disharmony, We have an opportunity to transform the systems and the values that sustain life on the planet. The sense of urgency in the face of converging crises has brought forward unprecedented attention to the interconnectedness of human societies and the biosphere, the need for global solidarity, large-scale coordination for science-driven solutions, and collective action. Therefore, educational institutions are uniquely positioned to contribute to achieving these transformations needed for a healthy future by incorporating planetary health education into the curricula. What you're seeing here on the screen is the collective work of a transdisciplinary group of scholars. And on the right-hand side is the Planetary Health Education Framework in detail that is available on the Planetary Health Alliance website, and a publication from our work as well. So now I'll just put it over to Teddy, and she'll talk in the next 3 slides, the timeline, scope of the framework, description of the framework design, and I will forward the slides for you, Teddy.
Thank you. Next slide, please, then. So you can imagine getting together a global group of transdisciplinary scholars and scientists. We decided that we needed to have a shared language. Planetary health is a solutions-driven transdisciplinary movement and field of science and practice. And we began to recognize that as this movement grew, we needed to pull together the global community. So that involved 5 steps that led us to this point. We had conversations with key stakeholders, we had brainstorming sessions to discuss the framework, and we drafted a key piece to be responded to. Then we iterated, and eventually launched. Next slide, please. So as I said, you can imagine as we started this process that how complex it was. We asked the question, if you were to choose items that every student in higher education should learn and have incorporated in their curriculum to learn about planetary health, what would those key concepts be? And I think we came up with 500 key concepts. Well, clearly that's not going to work. And clearly we needed to be respectful that there's not a lot of space in current curriculum to get this work done. So through lots and lots of iterations, we were able to get the project down to a manageable scope and framework. We're very clear that the framework is not a list of competencies, that it is allows plenty of space for disciplinary expertise, and that it's not prescriptive step by step. We wanted to make sure that it was a tool that all individuals in higher education, all faculty could use to help shape curriculum and design our curriculum. And we wanted to be also cognizant that there's many different ways of knowledge development and many ways of diverse learning. And so the tool itself is sets the stage for foundational language, a shared language for learners and educators. We were concerned that we might pull in circles people from agriculture, people from marine biology, people from nursing, and we would not have the shared language to communicate and create solutions that are necessary for our urgent problems. So the framework is a lexicon in many ways of this shared language that we can all move ahead. Next slide, please. The framework is purposely designed in a way that is egalitarian, in that we didn't want to set it up as a pyramid or a very linear process. We instead envisioned much like a rope. So what you're looking at here is if you took a rope where these domains, these 5 domains are threaded together and took a cross section or a slice of the rope, this is what it would look like. We were very clear that it was immensely critical for us to have at the core of our work re-envisioning humans within nature. So we our core domain is interconnection within nature. You notice the language shift is not reconnecting humans to nature. It's a shift in our understanding that we are nature, that fundamentally what we do to ourselves is manifest and what happens with nature, what we do with nature is manifest in in human health. So that's the core of our transformation. We feel that it's also important for students to understand the Anthropocene and human cause problems that are bringing us to this disruption of natural systems that are impacting human health. Another core domain is equity and social justice. That is not a sidebar conversation. It's not a nice conversation to add in after all the other pieces are complete. It is a fundamental aspect of this framework. So with systems thinking and complexity, that each aspect of this grand ecosystem that is called nature is interconnected and dependent on each other. That a change in one part of the system can have huge ramifications to another part of the system. And then finally, helping our students understand movement building and systems change. It's not enough to just have the knowledge about the urgency of the issue and where we need to go. We need to help students and equip students with the tools to build movements. Next slide, please.
Now over to you, Nicole.
Joe, thanks. I'm happy to continue the discussion that Dr. Potter initiated around the interconnection within nature, which was the central component of the rope, so to speak, as part of the educational framework. Next slide, please. But before we really go into this topic as part of the Planetary Health Education Framework, it's important to note the changes in the world that we've seen. And from my Indigenous perspective, we went very much from a circular and natural worldview to a very square synthetic worldview. And this lens of the world really affects how we create research questions, how background knowledge is retrieved and operationalized, how do we build curriculum, and even implementing our teaching methodologies in health spaces. How do we consider the hierarchy of priorities in our knowledge building process for students, as well as some of the solutions to our greatest challenges currently on the planet, such as that of pollution, biodiversity, climate crisis, and of course, even the pandemic. Next slide, please. Now, as we highlight here the interconnection within nature domain, it's important to state that understanding our role within nature as a species and as individuals is really foundational in planetary health science and practice. Yet despite this mounting evidence of our complete and utter interdependence within our biosphere, our civilization's perspective and consequently attitudes have not really evolved accordingly. We have this false sense of separation between humans and nature, which really perpetuates a deceptive culture of domination over nature, inducing many current environmental crises. Now, as there's been a long history of considering nature interconnection, we see that the interconnection within nature domain is centered in a continuation of similar frameworks, which have been described previously by other fields such as ecopsychology, environmental education, and related sustainability sciences, including terms like human nature connectedness, nature connection, connectedness within nature, connection. There's just a multitude of terminologies that we've seen. However, we will see shortly that this can also be applied within various knowledge systems. Next slide. So what do we mean by the interconnection within nature domain specifically? Well, in this domain, we refer to interconnection as an indicator for mutualism, for reciprocity, and for symbiosis. And we specifically, as Teddy noted previously, use the term within to denote that humans are a part and not separate from nature. We are in and of itself nature. And we really define the word nature as encapsulating earth and life, including humans, as noted a part of that. Now, within terminology, and all the terminology that I've used thus far really has thousands of years of collective history within my Indigenous community and many Indigenous communities around the globe. And as George Kajati aptly states, the culture's vitality is literally dependent on individuals in community with the natural world. Indigenous cultures are an extension of the story of the natural community of a place and evolve according to ecological dynamics and natural relationships. Next slide. We see the conceptualization of mutualism, reciprocity, and symbiosis depicted here clearly by Lucero and Cruz from the Mayan cosmocentric worldview, where there's a clear acknowledgement of the we in our existence compared to the I that often embodies many current approaches of being in the world, which furthers this false separation of nature and us. Next slide. Now, from my Indigenous lived experiences and teachings from my elders, we are all a part of earth-centered jurisprudence systems governing both nature and global. There's this unity of the natural laws that exist between us. So in this vision for a healthy future, it's incredibly important to create and mobilize the conditions, the learning, the understanding within students that enable the overcoming of the dissonance between, again, this being in nature, nature that surrounds us is external to us, comparatively to being of nature, or nature that embodies us. So when we think about our relationship within nature, we're really first talking about the relationship with ourselves then, being a part and in and of itself nature. So from a planetary health educational standpoint, we wish to foster a new ethos that supports resilient, next slide, resilient and vibrant socio-ecological systems. And as quoted directly from our educational framework, an interconnection within nature approach addresses the cognitive, this sense of connection, the affective, this caring component, and the behavioral, the commitment to act. And the interconnection within nature component reaches beyond the simple knowledge transmission of our social and ecological interactions, traditionally offered at educational institutions, and really hopes to surpass these superficial and short-term attempts to reconnect or spend time in nature. It's just not contact with nature, but the nature of the contact, the relationship that matters most. This deep awareness of belonging to nature may encourage students and professionals to pledge to protect planetary health. As a human species, we will need everyone to acknowledge the innate interconnection that exists within nature to promote the partnerships needed to create a healthy future for all. Next slide. So I share this quote from an Indigenous practitioner in Canada, which really embodies this meaning perfectly to close up this brief overview of an important and deep topic. Land-based is one of those words. It's a beautiful, wonderful term. It's bringing people back to the land and helping them become alive, and remembering their humanity and their connection to all living things. We are the land, so if we remember who we are, then the same miracle that we see all around us will be us. So with this, the interconnection within nature domain calls on educators to expand the content of higher education so that it includes Indigenous voices and presence, as well as other non-dualistic cultural, philosophical, spiritual, and scientific traditions that center the integration of humans with nature. So with that, Masi Cho, and I'll pass it on to my colleagues for the next section of the domain.
Thank you. So I'm going to speak to you about the Anthropocene and health. You cannot get through a single day without having an impact on the world around you. What you do makes a difference, and you have to decide what kind of difference you want. In this particular slide here, we're looking at that as of 2019, 23% of the planet's surface can be classified as wilderness. And actually that represents 10% decline over the past 20 years. Why is this important? It's because with the ongoing influence of humans on our ecosystem globally, that those areas that remain relatively wild will also be affected. As a result, the planetary boundaries, which are depicted in this diagram of 9 processes, regulate the Earth's stability and resilience. The point being made here is that if humanity operates within the boundaries of each of the processes, we will continue to thrive for many generations to come. However, as one can see, two of the processes have gone beyond the safe zone and are in what we call beyond the zone of uncertainty, high risk, being the safe zone, the light color of your legend at the bottom, and the darker color being the high risk. And this consequently increases the risk of irreversible to a large scale environmental changes. Under the biosphere integrity, ES/MSY at the left side of your slide indicates chemicals such as organic pollutants, radioactive materials, microplastics that are anthropogenic, resulting from the influence of humans on nature, is contributing to this high risk. So we're now what we call the Anthropocene is all about the human age. So Crutzen and Stormer coined the term Anthropocene, and it really is the start of the proposed geologic epoch, a period in time in which the dominant force is shaping Earth's biophysical condition is human activity. The Anthropocene is characterized, and we both, my colleagues have talked about, the massive disruptions in Earth systems processes, climate stability, and ecosystems that are a result of human activities. So within this last 400 years, there's been an increasing impact on the planet that has been associated with what we call the Great Acceleration, which is after World War II, there was a rapid rate in human activities and changing demographics, resulting in significant environmental changes, threatening the entire biosphere and humans themselves. What you see is a schematic illustration impacts of the anthropogenic changes in human health. When we look at our natural systems, there's these underlying, at the top of your slide, underlying drivers, ecological drivers, proximate causes, for example, air quality, food production. And then these have led to various mediating factors. And as a result, these are the drivers that impact one's health, as you see on the right side of the screen, resulting in things like increases in infectious diseases, more recently, global pandemic, malnutrition, displacement, conflict, etc. I really like this quote by Myers and Frumker's leaders in planetary health, and where we've got this diagram, and the book is there on the right-hand corner of the screen. Planetary health focuses on understanding and quantifying the health impacts, human health impacts, I stress, of what they call global environmental disruptions, and on developing solutions that will allow humanity and the natural systems we depend on to thrive now and into the future. So as I just described, one can see with what we call the Great Acceleration is the dramatic metric consumption, as you can see on this screen, that we have induced over this period from 1950 onward in terms of look at water use, transportation, energy use in our atmosphere, plastic production. So large metric consumption during this period of time. And then what we see on this slide is other impacts of the human impacts on the Earth's natural systems, result in, for example, you can see the loss in biodiversity, a steep increase in that, tropical deforestation, and additional of carbon dioxide in the air. So this table now summarizes some of the anthropogenic changes, some of which I've already stated alongside these impacts, but it's important to stress that on the left you can see there's a great biodiversity shifts, the way we use our land, and Dr. Redvers spoke about that, changes in our biogeochemical flows. You just have to look at the air, global pollution, climate change, extreme weather conditions, which we've all been experiencing, devastating effects most recently in many parts of the world with floods and hurricanes, and resource depletion. And just most recently here in BC, we've had on our Sunshine Coast, there's a lack of water, and so they're having to rethink about what we're doing there and just here in Canada. So what are some of the health impacts? And we can see as a result of this insult, disruption in our environment, there's changes in our infectious disease patterns, changes in our communicable disease patterns, nutritional disease, food insecurity, mental change patterns, and changes in reproductive health patterns. So where do we go from here? Well, it's described as the Great Transition, which is the fundamental shift in how people and human systems politically, economically, and socially interact to shape the highest attainable standards for the health of humanity and the state of the Earth's natural systems. So understanding these anthropogenic impacts on our Earth social system and how they're connected to health outcomes is critical. The importance of using a social and ecological approach to health promotion and disease prevention and control, ranging from not just the individual, but to the population level determinants of human health and ecosystem health. And then finally, this domain focuses on the underlying understanding, our students to understand the underlying and mediating factors that enhance or lessen health outcomes. Now over to you, Dr. Potter. Oh, just unmute yourself. Yeah, no problem.
So our students need to understand this broad interconnected system. I think so many are beginning to talk about the healthcare system and the challenges of the healthcare system, but those need to be situated in connection with all the other systems that make up our biosphere. Next slide, please. So systems thinking, what is it? It's a discipline for seeing these holes in a framework, for seeing interrelationships rather than things being seen as separate, to really recognize patterns of change rather than these static snapshots that we sometimes think of how a system works. It's creating the sensibility is really helping people understand the unique character of systems. Next slide, please. So this field of planetary health really underscores the importance of systems thinking and how various elements interact and are in relationship to create complex responses. It's essential to understand these links between environmental changes that Dr. Astle just mentioned and the human health at different geospatial and temporal scales. And that is important for our students to recognize complex adaptive systems. Learners also need to be aware, become self-aware and acknowledge their own biases in what they consider knowledge, the source of knowledge and how knowledge is generated. Because this is a time where we need to call upon many different forms of knowledge to solve these great problems. Next slide, please. We once understood system solutions. So this is the three sisters that is so well known and recognized in indigenous knowledge systems of agriculture: the beans, the corn, and the maize. All work or the beans, the corn, and the squash, all working together in a system that preserves the nutrients, helps each other grow, and has very beneficial aspects for human nutrition. Next slide, please. So we're trying to get our students back to there, understanding how systems work. We need to approach all of this with a sense of humility, that there's many ways, as I mentioned, of generating knowledge, that this is transdisciplinary. Nursing alone is not going to have all the solutions. Healthcare alone is not going to solve all the problems. We have to be able to work across disciplines, and that there's a great deal of uncertainty. We don't have all the answers. The answers are yet to be discovered and yet to be co-created as we come together and work together. We need to recognize our biases and that there's unintended consequences, that we might have a wonderful solution that looks great in our sector, but applying it might be very disruptive to another sector. That's part of systems thinking. Next slide, please. So part of this is helping our students recognize and understand systems from the tiniest little micro aspect to the largest planetary aspect. Next slide, please. And to be able to see systems at work in everything, certainly in healthcare and in nursing, we talk about human systems. But I will say that some areas of understanding, such as in Cuban nursing education circles, they talk about the importance of inside outside, where nurses come to understand the systems that work within our bodies and the humans are situated in the systems that work beyond our bodies. What a beautiful way of understanding systems thinking. Next slide, please. Certainly the Sustainable Development Goals that are put out by the United Nations also reflect this understanding of working and understanding systems, that all of these goals are dependent on one another and work in synergy together. Next slide, please. We have to really understand these relations and that there's feedback cycles, that what happens in one part of the system impacts the other parts of the system, that sometimes these responses are delayed. So you can do an action and think, whoa, that didn't work very well. And then all of a sudden the system moves. And so students need to understand that. I mentioned unintended consequences, and we need to be helping our students understand key leverage points, that there's points in the whole system that if we activate those, we get better and more impactful results. And sometimes the leverage points are counterintuitive. We might not, might not be what we expect. Next slide, please. And I will turn it over to Dr. Jessica Leclerc.
Thank you so much, Dr. Potter. So now I'll provide a brief overview of the equity and social justice domain. Next slide, please. So environmental and health impacts of our changing planet are not distributed fairly across populations, species, geographies, and generations. So, for example, while the world's high and upper middle income countries are responsible for the majority of carbon emissions, the burdens of climate change are disproportionately felt by frontline populations, including low-income countries, island nations, indigenous peoples, young and future generations. So equity in planetary health incorporates the rights of humans and the rights of nature because we are interconnected, giving all human populations and ecosystems, present and future, the opportunity to attain their full vitality. So to realize a more equitable planet requires eliminating systemic disparities, such as power, wealth, opportunity, or health status, so that no population carries disproportionate, avoidable burdens of environmental and health impacts while others can thrive. Next slide, please. So environmental racism is key to understanding planetary inequities and injustices because it describes any policy, practice, or directive that disadvantages individuals, groups, or communities based on race or color. So environmental racism has affected Black, Brown, and Indigenous communities for centuries through overexposures to polluted locations. And communities impacted by environmental racism are sometimes referred to as frontline or fence line communities. Frontline communities are often the first to experience planetary health crises. Fence line communities are groups that are living close enough to an industrial or toxic environment to experience harm from the associated pollutions. Many species and other life outside of humans also experience planetary health injustices through the loss of healthy habitats and extinctions. So multi-species justice is a term that expands the idea and the practice of justice to encompass and respond to the destruction of multi-species ways of life and rejects this idea of human exceptionalism. So the planetary health crises threaten all life, inflicting unjust burdens on marginalized and displaced peoples, other species, and their interconnected ecosystems. Next slide, please. So planetary health educational processes must acknowledge the root causes and worldviews that perpetuate structural inequities and how historical and political injustices have contributed to the disenfranchisement of populations and a degraded environment. So our graduate nursing students at UW-Madison are taught the Critical Environmental Justice Nursing for Planetary Health Framework. And this framework seeks to guide and integrate the use of critical inquiry methods into the conceptualization of the human roots in planetary health as patterns of domination. So for example, supremacy and capitalism that are then expressed as patterns of violence, for example, slavery, ecocide, femicide, and genocide, that are then manifested in patterns of health. So for example, despair, morbidity, and mortality. And this framework is a population-based approach to health promotion that applies critical theory to the way injustices are conceptualized as health risk factors. The framework builds on population health and planetary health as inseparable pathways to health equity. It requires critical nursing inquiry in the development of ethical responses to environmental injustices, and explicitly challenges the hierarchical belief that people who are not white, male, or human are lesser beings that can be made profitable. So understanding these root causes is essential because it paves the way for the development of more accurate and effective nursing strategies that promote both personal and planetary health. Next slide, please. So to address inequities, focus must be on the health and well-being of populations and ecosystems on the front lines and fence lines of environmental degradation. Frontline and fence line communities have been fighting for justice for centuries and are key contributors to solutions addressing the planetary challenges we face. Affected groups, including Indigenous peoples, continue to demonstrate resilience to large-scale environmental and social changes resulting from ongoing colonial processes. Planetary health practitioners who are not themselves from such communities can learn from impacted people by prioritizing their wealth of knowledges for potential solutions, again, referencing back to the interconnection within nature domain here. It's also imperative to consider multi-species again and intergenerational environmental justice and equity, which ensures that the actions of the present generation protect the health of future generations. Next slide, please. So following an understanding of the connectedness between human-driven changes in our planet and the accompanying consequences to populations described in this and the previous domains that we've been discussing, solutions must be found to address these challenges. And future nurses for planetary health must be able to rebuild the institutions, such as the laws, healthcare, education, that promote and reproduce inequities and shape planetary living conditions. So I utilize the social ecological model to help identify priorities for action when focusing on planetary health and justice as a nurse educator. And the students find it very helpful. So social ecological models have evolved over time. Dr. Golden added the cultural domain that you see here to represent how the social ecological model shifts away from an individual biomedical paradigm and instead promotes a recognition of the social and structural determinants of health and health equity. Each of the levels is interactive and reinforcing, so they have a cumulative effect on health. Therefore, nurses who want to partner with communities to advance justice must concurrently address factors identified at multiple levels. So understanding systems of power can enable solutions to improve planetary health outcomes. Although interventions aimed at exclusively individual and household level behavior changes continue to gain prominence, especially in nursing and public health. And this individualistic focus can actually burden populations that are already impacted by inequities. In fact, this approach can then result in a distraction from structural, political, and institutional responsibilities to promote planetary health. For example, we cannot mitigate climate change without also holding accountable the 20 companies responsible for 1/3 of the worldwide carbon emissions. And further, we can't promote food security without also holding accountable the agri-food industry transnational corporations who govern and control the world food system. Next slide, please. So in order to transform systems of injustice, large-scale power movements must continue to build momentum, and the next domain will cover this in more detail. Promoting equity and justice in planetary health includes supporting resilience, strength-based approaches, and a just transition. For example, the Just Transition Framework that you see here describes principles for a transition from an extractive economy to a regenerative economy that assures vitality in communities. The framework guides strategies that are rooted in the work of environmental justice groups and labor unions in alliance with fence line and frontline communities to define this transition away from polluting industries that were and still are harming workers, public health, and the planet. Next slide. Thank you so much for your close attention. These are my reasons for persevering in this work. These are my two boys who love nature and apple orchards, and I'll pass it on to Dr. Potter for the next domain. Thank you so much.
Thank you so much. I find this the most exciting section. All of them are important, but knowledge is not enough. We need to put it into action. So what does this mean for nursing, nursing faculty, and schools of nursing? Next slide, please. So again, we can be inspired by these ideas, but the key is we want to get our students and higher education moving on these ideas. Next, please. So in the United States, we have the story of Rosa Parks. The story was that she was tired from a day's work of doing household maid work, and she was exhausted. She sat down on the bus. She sat in the white section of the bus and was arrested because she would not move. And that launched the civil rights movement. When in fact, Rosa Parks had been very much a part of strategizing the best levers to pull. I mentioned levers to transform the system. And they knew that really taking the whole bus system into account and making them recognize the harms that were being done to people of color would really help to start to transform the system. So sometimes we think that movements just magically appear. It just involves one person suddenly taking an action and everything falls in place. When in fact, movement building is very, very strategic and has some key elements. Next slide, please. So movements require inclusive relationships. Very rarely do effective movements, very rarely are they based on one small group of people. It's groups of people gathering together, beginning to have a message of us, a message of how does this impact us. Next slide, please. And as I said, movements are very, very strategic in that you look at the system, you look at the impacts of moving one part of the system and how will that impact other parts. Are there possible unintended consequences? Where are the good leverage points? What's the nature of this complex adaptive system? And what actions are important to take now versus perhaps later down the line? Next slide, please. Movements also require effective communication and multiple ways of communicating and multiple ways of telling a story. So it requires students to understand various stakeholders and what helps them understand the purpose of the movement. So sometimes students need to be prepared with just plain data. Data and facts will drive the change. Sometimes they have to be able to, and be prepared to talk about a return on investment. What's the business argument for an action moving forward? And sometimes they need to really pull the lever of ethics. And nurses are very, very good at talking the story of ethics. We're the most trusted profession in the world, and people understand that we are pulling forward and our messages are important for human health. Next slide, please. Movements are also a transformational partnership. And you've heard the previous speakers talk about this, that movements are not hierarchical. They work across boundaries and borders. They work across disciplines to listen deeply to the needs of each element and move that forward. Next slide, please. We oftentimes have a statement in movement building of it's important to go slow to move fast. That developing these relationships is key to a highly effective movement. Nurses are wonderful at relationship building. We understand this. That's what makes nurses highly effective in leading movements. Next slide, please. So the final thoughts about this is we need to understand that we are in an urgent crisis, that the Earth's planetary boundaries are being disrupted at an alarming rate, that the death of the biosphere, the death of animals, the loss of biodiversity is having impacts on human health. We need to understand this critical message that now is the time to act. We have a very small window here, but relationships, building relationships and being strategic and communicating effectively are reasons to hope. We have the solutions. We know the solutions. Now it's a matter of coming together to get the work done. And with that, we open it to questions. Next slide, please.
Thank you very much, all my presenters. And what I'm going to do is I'm going to take us off of shared screen. And so we'll have about close to, just around 10 minutes for questions, maybe a little longer, and that will then end the webinar. So I'm just opening it up now. I'm not sure, Dawn, is there, if you've got a question, if you want to put that in the chat and you can direct it to any of us, or we'd be happy to entertain some questions at this time.
If you want to raise your hand, we can see whose hand is raised. If you'd rather, speak, that'd be great too.
Or if you want to make a comment.
And while people are forming their questions, I might give some examples, and I ask my colleagues to give examples of how the Planetary Health Education Framework is being used. So we're using it in our School of Nursing at the University of Minnesota to guide our curriculum design for all our levels, our BSN, our master's, and our DMP, and our PhD. The Planetary Health Education Framework is being woven through each of those levels in every course and in every lecture. We're looking at those domains and saying, will our students be ready to graduate practicing as nursing for planetary health? That's being done at our school, and we are working across the nation to get this message out, and other schools are beginning to do that in the United States as well.
Lindsay. Just unmute yourself. Go ahead. Nice to see you.
It's nice to see you too. Thank you all so much for presenting on this. This was excellent. I have a question about your curriculum integration. Are you bringing in other disciplines into these classes, or is it strictly nursing?
In our area, we are actually in the United States, we're the National Center for Interprofessional Education and Practice. So our students are exposed to exposed to each other and exposed to practicing interprofessionally. We have physicians, pharmacists, social workers, public health, veterinary medicine folks coming in and working with our students, but they're not quite as ahead as nursing in understanding planetary health. So one of the things that we've been able to leverage is the Planetary Health Report Card, which was created by students. The students of the schools can grade their schools and their professors on how well they're integrating planetary health into their research, their lectures, and their service. How well is their university doing that? And I've been able to kind of tease my colleagues over in the medical school. Well, you've moved from a C to a C minus. That's wonderful. Congratulations. But the School of Nursing is getting an A. So got a little bit more work to do. So it's a wonderful tool, student-driven tool. They're the ones that grade us for us to start to move this whole movement forward.
That's excellent. And I see Dr. Leclerc put it in the chat. I'm very excited. Hopefully we can use that in our university. Thank you.
And I might add, Lindsay, if you're interested more about that, that's something that we've started at our university. So I'd be happy to partner with you and get you up to speed. But what's really neat about it, it's student driven. So it's quite exciting. We don't have any programs in Canada doing it except our own at the moment. But I want to follow suit with you, Lindsay. It would be great.
Amazing. Thank you.
Yeah, please contact us. Anyone else have any? Oh, Helen. Hi, Helen. Welcome.
Thank you. Thank you. And for the excellent presentation, so helpful. I'm most interested in Dr. Potter in what you've manifested, this operationalization of the Planetary Health Framework. I'm very much into the movement building part of this in my role with the Canadian Association of Nurses for the Environment. I'm wondering if you could share with us how that translates in the application of the curriculum. Do students, for instance, do some practicums or project development, and what ideas do you have regarding that? Thank
Well,
you.
thank you for your question, and thank you for your leadership. I'm thrilled to hear that you're moving ahead in this sphere. It's a golden opportunity in the United States right now, because every, I would say 5 to 7 years, our American Association of Colleges of Nursing, similar to your program, come out with the essentials, the nursing essentials that need to be met in every professional school of nursing in the nation. So all schools right now are redesigning their curriculum. So we said, what a golden opportunity to weave in planetary health. They're already redesigning their courses. So we use this opportunity to set up, here's the core domains, the Planetary Health Education Framework. Here's the core competencies at a baccalaureate level and an advanced practice level. And how do we thread those? How do we weave those together? Giving very practical tools, resources, and options for the classroom. I'm very happy to share those. And so I'm going to put my email in the chat, and anybody who contacts me, I'm willing to give the link to what does that look like in our curriculum.
Thank you so much. Very helpful.
And thank you, Teddy. And Teddy, she knows already in Canada, that's something that we're now as well is going to be mandated, planetary health within our curricula. So I'm doing a bit of work, and if anybody would like to see what I've been doing for the last 6 years in my curriculum, I'm happy to share it. But what Teddy was talking about is that threading through. And so that's something, it's going to be mandated within our curricula across Canada. And how we're going to do that, some of us have been doing it ourselves for a few years, but now there's more of that movement that Teddy's talking about. So please reach out to us. I just was going to say, Nicole, can you comment a little bit about how you've been integrating some of the framework in where you're situated?
Yeah, absolutely. And a little bit out of the context of nursing, but I think this speaks to the interdisciplinary, the transdisciplinary component of the curriculum that we were talking about earlier. That's really critical to the framework, because we tend to operate in our health system silos, in our health professional silos, without really a lot of crosstalk. And this space is ramped with opportunities for cross dialogues with other healthcare professionals, but also other members of the community as well. So we've really tried to embody that as part of our teaching process, not focusing only on medical specialties or only on Indigenous knowledges or only on certain elements, but really trying to find opportunities to have cross-pollination experiences for students where they can really be free to have conversation and do work focused across the disciplines as they practice. Because otherwise what happens is they get out in the world, and yes, we see these frameworks, but they're not quite sure how to go about doing that. So enabling those skills during the student experience really gives strength to that movement building, because they have key strategies to be able to work across silos that may not necessarily have occurred otherwise.
Thank you, Nicole. And I think what's really important there is that notion that we can't work in silos anymore. You know what I'd like to, it's from Maureen. Maureen, thank you. She says it's very important, and enjoyed the session. The one important message I get from this presentation is that every individual must take the very important step with at the individual level, with responsibility, respect, and with the deep understanding of planetary health education. Every nurse must think, as a bedside nurse, in what ways I could help to be part of planetary health education in my work setting. That's a great question. I'm going to see if any. I have some thoughts on that, but what about you, Jessica? Did you want to?
Yes, thank you. I was just looking for resources to support that. So so climate change, as we've shared, is just one thread and one example of planetary health breakdown. But sometimes this is a nice entry into the broader conversation of planetary health. So I'm sharing this resource for nurses that work in hospital health systems at the bedside, for starting the conversation at your unit or your staff meeting, to start with climate change, and the Nurses Climate Challenge is a wonderful resource for that. They have, for example, already put together, letters or emails you can send to your supervisor. Can I get on the staff meeting? These are some things I'm concerned about. They have PowerPoints, 10-minute, 20-minute presentations with notes already done and crafted for you that you can bring to a meeting. What we would ask is that you also, as Nursing for Planetary Health, we're bringing in that larger context as well. And so on that note, the Planetary Health Alliance, which was the lead organizer for this framework, also have some put together PowerPoints and things like this under their education tab and other resources for how you can present on these topics. So I wanted to highlight those resources for you as well.
Barb, I see that Rhonda has a question, Barb.
Oh yes, Rhonda, please go ahead. And, yeah, thank you.
I would just love to thank you all so much. This has been just so wonderful and exactly what I've been looking for. I am a faculty member at Douglas College. Barb, you've spoken with the health sciences a few times with us. So I'm a learning strategies coordinator at Douglas College with the health sciences, but I'm also faculty in the veterinary nursing program. So I've always been looking for ways to do that interprofessional collaboration. And I'd love to reach out to all of you later just to get some ideas, because I always have these ideas swirling around and it just always seems so big. And I'd love to get some pointers on how to just get started on just having that collaboration between the two faculties and how we could really get this movement going.
Right. Well, Rhonda, please reach out to myself or any of us here. And you heard what even all of us have said. This is work that we have to do together. It's imperative. We are leading the way in our institutions, but we, some of my work even in Canada, how I certainly work with other disciplines and with other departments. So thank you. I'm a little mindful of the time, and so what I'd like to suggest, if this is fine, is that two things is. Teddy, Dr. Potter, and Dr. LeClaire and myself will be speaking at the Planetary Health Alliance meeting at the end of the month, which is in Boston, Harvard. And I'm just not sure, Nicole, are you going to be there at the meeting as well? Yeah, I thought so. So we're going to be talking about planetary nurses for planetary health. So I think you can register today and get on that site. We'd love to see you there, as well as here in Canada. Dawn, they said if I could put a call out, we're starting a planetary health interest group. The first meeting is tomorrow, and I'm chairing that. So anybody that's interested in planetary health here in Canada, that'll be an interest group, and that will also be a good place for our colleagues to meet and talk about more about this and how we can move this and instill this within our educational programs and just as us beyond just ourselves. Teddy, is there something you would like to add about? I just thought this is a good time to.
I really want to encourage people to go to the Planetary Health Alliance website, because as educators, there are syllabi there, there's book recommendations, there's research papers, there's case studies, brilliant, beautiful case studies with instructor guides on how to put those into your class. So you don't have to be an expert before you start. All you have to do is begin to acknowledge to your students that this is an issue we have to be talking about as nurses. And then students that I talk to say, thank goodness, I have been an activist over here, but I didn't know nurses do this. So they're so excited that this is part of our profession. And the resources are, many of them are there on the Planetary Health Alliance website.
Oh, thank you so much, Teddy, for that. Yeah, it's a fantastic resource. So do we have time for one more question? I could just.
Barbara, I just want to point out that Jessica from Kazan has put in a link to the Planetary Health interest group meeting tomorrow. So if people, there's a link there if people want more information. Just wanted to quickly point that out.
Oh, thanks, Dawn. And it looks like we've got a bit of interest. So that's fantastic. And hopefully we'll have others from this group as well. So it's just about the top of the hour, and on behalf of Calvin, Dawn for organizing this, Dr. Potter, Dr. Redvers, lovely Jessica Leclerc, my colleagues, I just always enjoy when we get together and talk about something that we're really passionate about, the planet. And so I'm going to close it there and wish many of you blessings, and take care of yourself and take care of our planet. Thank you very much.
Thank you.